Good morning, everyone. This is Bill Keegan, Town Manager in Foxboro, with your latest COVID-19 update. So, good morning for us on this beautiful Friday morning, and I hope you're enjoying the very fine weather. It's a little on the cool side this morning, but certainly a lot nicer in terms of the sky. The sky is nice and blue this morning, so hopefully it stays that way, and have sort of a lead into a nice weekend. Though I heard a little bit of concern about maybe some possible snow tomorrow, but I don't think it's going to affect us that significantly here. So let's get right to the numbers. So this morning we have a total of 92 cases that have occurred here in Foxborough since March 15th, and then total recovered is 64. We have 20 positive cases that are currently active in town. That's actually down a little bit since yesterday. And a total of 7 cases have been lost during the follow-up. A total of 473 cases have, in fact, tested negative. There are 3 people who are still hospitalized. Those cases, that number has not moved in about 2 weeks now. So, hoping that those folks are going to be okay, and let's see if we can get them off those records, that total fairly soon. One person has passed away as a result of COVID-19 complications since the beginning of the process. So let's take a look at what's going on the countywide and statewide basis. It looks like right now we have a total of 73,721 cases in Massachusetts. A total of 351,652 have been tested. In terms of countywide implications here in Norfolk County, we currently have 6,729 cases of COVID-19, and we have total deaths of 608 statewide. I mean, countywide from that perspective as well. Suffolk County is at 14,732, 663 with 663 deaths. We're not far behind Suffolk County, strangely enough, in terms of deaths related to COVID-19. Middlesex County continues to lead the way, though, with 16,676 cases and 1,103 deaths associated with those cases. Right now, there are 18,000 COVID suitable beds. That includes temporary and permanent beds. 3,349 individuals occupying those beds, which is down rather significantly this morning. So it's good to see that trending in the right direction. And also, the number of COVID-19 patients in ICU has trended downward as well, from roughly around 900 cases down to 826 cases. So that's a pretty good jump down in the right direction this morning. So glad to see that going in the right direction as well. On a statewide basis, the governor has consistently indicated that the numbers are starting to trend in the right direction, but we have not seen enough consistency in that trend to actually consider it to be in that 14-day cycle. So we'll have to pay close attention to see if that in fact affects his decision with the stay-at-home policy beyond May 18th. Obviously, the face mask requirements are still in place for everyone, so please be mindful of that when you're out and about, that we should be wearing a face mask if you're in areas where avoiding the public in 6 foot and social distancing is not possible. So this is an important message on the statewide update this morning. On the town manager update, we have an important message about statewide contact tracing efforts. Working with boards of health, and the Mass COVID team is using a contact tracing program to help flatten and reduce the curve of the spread of COVID-19. Contact tracing is an important tool, and the Mass COVID team is part of the Community Tracing Collaborative created by Governor Charlie Baker. Everyone who has tested positive will get a call from the Board of Health or the Mass COVID team, making sure that they have the support they need to quarantine and get better, and to find out who they have recently been in contact with. The team or the Board of Health will then talk to those contacts, encourage them to get tested, and to stay at home to not spread the virus further. Together with massive testing and hospital care follow-up, contact tracing is absolutely essential to stop the virus and to get our communities moving again. So what happens next? Answer the call. Is the important message here. You will receive a call from Mass COVID, the COVID team. The number will either be 833-638-1585 or 857-305-2738. it is important to answer that particular call. And so that you will only get, let's be clear about that, you will only get a call if in fact you've tested positive, and in fact they're doing a follow-up to make sure they're trying to determine who you've had contact with so they can actually follow up with those individuals as well. During the phone call, a case investigator will ask you for a list of all the people and places you were 6 feet or you were within 6 feet or during the 48 hours prior to your symptoms. For those who do not have symptoms, include all the contacts 48 hours prior to your diagnosis. And the case investigator will also ask for the phone numbers of any people you can identify so that they can be reached out to and notified about their exposure. While we encourage you to inform your contacts about your illness, the state will not share your information. We'll call your contacts and tell them they have been exposed to COVID-19, so they need to get tested, but we will not release your name. This process is called contact tracing, and is a very important piece to fighting this pandemic and stopping the transmission. We will not share any information with immigration officials or ICE. If you are staying at home during the isolation period, the case investigator will also discuss any needs you may have with this for this time period, and may connect you with a care resource coordinator who will help you to get the support that you need. A case investigator and/or local board of health will check in on you regularly to monitor your symptoms and needs as necessary. One of the key people is Deputy Chief Tom Kenvin, who is also the town's nurse from the Board of Health. Excuse me, it's dry because of my allergies. And wanted to just let you know that he most likely it'll be him or a member of the Board of Health staff will be reaching out to you at some point to follow up with your case, and has been doing that a lot as part of his responsibilities in the role of town nurse. So what should you do if you test positive? You should self-isolate immediately. This means staying 6 feet away from others at all times and living and eating in a separate space. More self-isolation instructions are given here as well. Anyone living in your household should get tested immediately. If you live near Lowell, use the online CVS system for the Lowell testing site. Otherwise, contact your health provider, doctor, to order the test. Everyone in your household who tests positive needs to self-isolate. If anyone in your household gets test negative, you need to self-isolate away from them to minimize the chance that they contract COVID-19. If anyone in your household is high risk, they need to get tested and to self-isolate. This includes anyone over 65 and people with diabetes, chronic lung disease, heart disease, kidney disease, cancer patients, or folks on chemotherapy, anyone who is immune compromised, and pregnant women as well. Self-isolation instructions, it is very important that you self-isolate now that you know you have COVID-19, if in fact you do. Your self-isolation will prevent additional spread of COVID-19 and protect your family, friends, and neighbors. Here are some instructions. So these are instructions for those people that have contracted COVID-19 and are in the process of being traced and given instructions to self-isolate. This does not apply to the general public, so just only to those people who have actually been found to have contracted the virus. Isolation lasts until your local Board of Health tells you that it's safe to stop self-isolating. They will make that decision based on your ongoing check-ins regarding your symptoms and needs. Do not leave your home except for urgent medical care. If you must leave or wear a mask, make sure to call your doctor before you seek medical care from him, her, and tell them you are diagnosed with COVID-19. Do not take public transportation, ride shares, or taxis. If you do not have a car and need emergency transport, call 911. Keep 6 feet distance from other people at all times. This means sleeping in a room alone and using a different bathroom if possible. Do not have visitors in your house. Do not share food or personal household items. Wash your hands frequently throughout the day with soap and water for at least 20 seconds. Wipe down surfaces that you touch frequently with bleach if possible, or household cleaners. COVID-19 can live on surfaces for days. Anyone you come in contact with, including anyone in your home, must watch themselves for fever, cough, and other symptoms while in isolation. Those are the key items. And so, if in fact you are part of the tracing effort, or if you've come down with COVID-19, those are some of the major steps that should be taken if in fact you have concerns You can certainly call the Board of Health here in Foxboro and reach out to them, and they will give you any further instructions you need if, in fact, you want clarification on any one of those points. So, from the MRC email this morning, as we prepare for the eventual reopening of the economy and the relaxation of some of the current public health restrictions, it will be important to focus on testing and contact tracing, as we just talked about. Federal guidance and public health best practices requires robust testing and contact tracing frameworks to be in place before a large-scale reopening can occur. So that's why we've taken the very expanded steps to do the contact tracing, because it is the best way we know of to try and keep the spread of the virus down as much as possible. And let me see here. Just some information about antibody tests. You may be reading in the news about the role that antibody tests will play in our pandemic response. In short, these tests detect the presence of antibodies in the blood, which are proteins that can result from an immune system responding to an infection. If accurate, these tests can tell us who has had the virus in the past, even if the virus is no longer present in their body. There are two relevant questions relative to the antibody tests. Are they accurate? There are emerging concerns that there is a wide variation in test accuracy. The FDA is working to gather data on test accuracy and improve more antibody tests for widespread use. And two, the presence of antibodies is detected in your blood. Are you immune? With most viruses, having antibodies means that you are immune to getting the same virus for the same period of time. However, we don't know if this is true to COVID-19 since the virus is so new. There isn't yet enough information to confirm whether the immunity is conferred, or if it is, how long it lasts. If accurate antibody tests can be developed and we can confirm that immunity is conferred for some period of time, this will certainly help enable us the reopening effort until a vaccine can be developed. Mass General Hospital recently published a useful overview of antibody tests and their role in COVID-19 response on their website. So let's take a look at the numbers again. There are 73,721 confirmed positive cases of COVID-19 in the Commonwealth, with 1,696 new cases and 4,552 deaths as of yesterday at 4 p.m. Overall, 351,000 tests have been conducted by public and private resources. 14% of the 11,993 tests reported today were positive. Of the 3,436 individuals are hospitalized with COVID-19. That's a decrease of 126 from yesterday. The Department of Public, day before yesterday, I should say. The Department of Public Health has regularly released data reporting dashboard containing information, and we're all aware of that. Personal protective gear, 297,000 new N95 and KN95 masks, and 136 ventilators were just recently distributed. Mobile testing, the Massachusetts National Guard continues to test throughout the Commonwealth for long-term care facilities, and they've made 588 visits and conducted 33,416 tests as of March 7th. It was actually interesting to point out, by the way, that the more we test in those facilities, there seems to be this trend occurring where when they do the test, they find that a good percentage of the people have either already had it or people that have it are showing no symptoms whatsoever. So that's kind of interesting, and that's why it makes it so difficult to fight this particular virus, is that people may have it, don't even know it, and as a result, they could be spreading it without even having the ability to know that they're doing that. So that is the challenge that we face. That's why it's important to follow the right protocols and wearing a mask and wearing gloves, etc., and keeping the 6-foot distance from everybody. And somebody pointed out to me this morning that people with high blood pressure are also at risk, and it's important to point out that there are folks with any kind of immune deficiency orders, anything like that, are ones that are certainly the most high-risk people that we need to be careful about. And certainly, and also what's interesting to note, excuse me, in looking at the most severe cases and the fatality rates, are mostly in the area of the ages of 70 and above. There are some numbers, and the numbers decrease rather significantly below that, but there are still numbers throughout each one of the various age categories. and we want to make sure that people are aware of that. But clearly the biggest impact has been the age 70 or greater, and that's the impact that's been felt the most in terms of fatalities. So let me see, checking to see if anything new here that we should share with you this morning. And again, the stay-at-home order is good until May 18th. There's been no indication that date is going to change. Though it is interesting to point out, as I noted earlier, that if in fact the consistency of our cases declining in the right direction has not occurred for at least 14 days, that's the federal guideline that the governor and most states are following. If that has not occurred, which does not appear to be the case at this time, that we may be in a position where you may have to extend that further. But we'll wait and see. I mean, I'm not going to make any predictions at this point, hoping that we can see some steps that can be taken, and certainly some relaxing of certain issues. It was noted that golf courses were reopened yesterday, but for some very strict limitations as to how that can be done and how that can be played in a safe format, so that the spread of the virus does not continue even on that type of scenario. So that's the latest information we have. I will continue to keep you posted as I have been for the past several weeks, and I appreciate you watching and joining with me in the morning to get this latest information. I'll be back with you again tomorrow morning. Even Saturdays and Sundays we do this report to make sure you keep the latest information up to date on what's happening in and around Foxborough and around the Commonwealth. Again, I want you to stay safe, try to enjoy some good weather, and get outside as much as you can, because that is good in terms of combating against the virus as well, by the way. But certainly get out there and enjoy it if you can. And stay safe, stay healthy, and I'll see you back here tomorrow morning. Have a great day.